Assalamu alaikum. My name is Dr. Hashim from Department of Pediatrics, Cookie Trust Teaching Hospital, Lahore. Today I will be presenting a study on laparoscopic appendectomy in children with acute appendicitis. Acute appendicitis is recognized as the most common surgical emergency in the pediatric population. Traditionally, it has been managed by open appendectomy, which, although effective, is associated with certain drawbacks such as higher rates of wound infection, increased postoperative pain, and rarely long recovery periods. Okay, just a second. Okay, background and clinical context. With the advancement of the minimal invasive surgery, laparoscopic appendectomy has gained popularity over the past few years. It offers several potential advantages, including smaller incisions, faster recovery, the better cosmetic outcomes. However, despite its increasing use, there is still limited data regarding the outcomes in the children, particularly in our all healthcare settings. Okay, the study objectives. The aim of the study was to evaluate the safety, efficacy, and the short-term clinical outcomes of the laparoscopic appendectomy in the pediatric patients aged between 2 and 18 years, conducted at a tertiary care center in Lahore. The study was designed methodology. The study design, inclusion criteria, and the statistical analysis. The study was designed as a retrospective analysis, meaning that the previously managed cases were reviewed. A total of 150 pediatric patients were included over a period spanning from January 2023 to December 2025. Only those patients with the confirmed appendicitis diagnosed through which are diagnosed through the ultrasound or CT imaging were included in the study. The researchers evaluated several important clinical parameters. These included the operative time, length of the hospital stay, post-operative complications classified according to the Clavian-Dindo system, and the readmission rates within 30 days. Appropriate statistical methods, including chi-square tests, t-tests, were applied, and p-value of less than 0.05 considered statistically significant. Moving on to the results, the mean operative time was approximately 45 minutes, indicating that the laparoscopic appendectomy is a relatively efficient procedure. The average length of the hospital stay was around 1.2 days, which reflects a rapid post-operative recovery. The overall complication rate was observed to be 8%, and importantly, most of these were mild complications classified as grade 1 or 2. The 30-day readmission rate was low at only 2%. Notably, that there was no cases that required conversion from laparoscopic to open surgery, which further supports the feasibility and reliability of this approach. When these results compared with the historical data from open appendectomy, a significant reduction in the hospital stay was observed, approximately 40% shorter, with a statistically significant p-value of the less than 0.01% highlights a clear clinical advantage of the laparoscopic approach. Okay. Complications and perforation profile. The key safety findings: zero conversion to open surgical. As I stated earlier, the zero conversions to open surgery recorded. In conclusion, this study supports the use of the laparoscopic appendectomy as a first-line treatment option in the children with acute appendicitis due to its favorable safety profile, low complication rates, and faster time. Okay, laparoscopic versus open surgery. Open appendectomy, higher wound infection, higher risks, longer healing time, extended hospital stay. The historical standard with the well-documented limitations in the pediatric patients, laparoscopic appendectomy, the length of the stay reduced with a 40%, p-value less than 0.01%, versus historical open data, low complication of rate 8%, faster recovery, and no open conversion in this cohort. Clinical significance and healthcare impact reduce the clinical significance is with reduced morbidity, faster recovery, and the cost savings. Low complications rates even in the Complicated appendicitis cases validate laparoscopy as a first-line treatment and option. The faster recovery, shorter length of the stay, and the minimal readmissions translate directly into the faster return to the normal activity in the pediatric patients. Cost saving, reduce hospital stay, and lower complications burden may significantly decrease overall healthcare expenditures. Conclusions. Laparoscopic appendectomy is a safe procedure, effective for the pediatric appendicitis with the shortest length of stay and the low complication rates. Even is complicated cases validated. First line treatment है, broad adoption recommended है, future research needed, which is research supports laparoscopic appendectomy as a preferred initial approach in the children aged 2 to 18 years. Wider adoption in the pediatric surgical centers is encouraged to reduce the morbidity and the shorten recovery time. Prospective trials should focus on the advanced imaging guided techniques, especially for the perforated appendicitis cases. Thank you so much.